Welcome to this week's Grassroots Health Scientists Answer Your Questions webinar. Today we are presenting an extended version of one of Dr. Michael Holick's previous webinars on vitamin D and the sun, addressing one of our most frequently asked questions about how to get your vitamin D, from the sun or from supplements. Dr. Michael Holick, who many also like to call Dr. Sunshine, is Professor of Medicine, Physiology, and Biophysics and Director of Clinical Research at the Boston University Medical Center. Would also like to quote from Dr. Holick's book, The Vitamin D Solution. Today, there is evidence to link sun exposure and vitamin D to every facet of medicine and health. We are very excited to be presenting another webinar with the delightful Dr. Michael Holick as he discusses vitamin D and the sun.
Welcome all. Hopefully I can give you a very broad overview about vitamin D, and hopefully I'll convince you that it is a delightful vitamin. And what I'm going to do is to talk about sunlight for your health. And most importantly, I get support from NIH, formerly from the UV Foundation and also from the Mushroom Council. But much to the dismay of the dermatology community, I also get support from the sun. And I think that, as you're well aware, vitamin D deficiency is a very common problem, and that essentially everyone globally is at risk. And that we now recognize that vitamin D isn't only for the prevention of rickets, but may be important for preventing osteomalacia. It's a painful bone disease that often adults can acquire, especially during the wintertime. Also diabetes, multiple sclerosis, rheumatoid arthritis, infectious diseases, hypertension, heart disease. Many cancers have been associated with vitamin D deficiency. And that link with sun exposure and vitamin D has given us a great insight into many of these disorders. And so whether you're an amphibian or a reptile or a bird or a lower primate, they've always depended on sun for their vitamin D requirement. In fact, I always wondered about our hunter-gatherer forefathers, and there's been a lot of talk about Neanderthals, and recently their DNA has revealed that they weren't dark, hairy creatures, but rather they were Celtic skin with very light skin, redheaded, and the reason is that as they migrated north and south of the equator, that it was necessary for pigmentation to have devolved in order for them to have made enough vitamin D, and the major function certainly was for a female to have a normal pelvis so that she'd be able to procreate. We know that women who are vitamin D deficient in utero in their first few years of life often have a flat, deformed pelvis and have a very difficult time with childbirthing. So how do you make it? It turns out that it's the precursor of vitamin D is 7-dehydrocholesterol. It's the precursor of the cholesterol biosynthetic pathway. Now you may wonder, if you use a statin and it inhibits cholesterol biosynthesis, will that be a problem? And the answer is no. Statins don't get into the skin, will not influence vitamin D production in the skin. It's always been an issue whether or not, if you were a lifeguard or a sun worshiper, would you make too much vitamin D in your skin? And the answer is no, because Mother Nature cleverly designed the system so any excess exposure to sunlight rapidly destroys any excess vitamin D, so you can never become toxic from sun exposure. I'm always asked the question, is there any difference from taking a vitamin D supplement and being exposed to sunlight and making vitamin D? And the answer is yes. Dr. Haddad many years ago showed that vitamin D produced in your skin lasts 2 to 3 times longer in your body than it does if you take it as a supplement. For us, in 1921, it was Hess and Unger, 2 physicians in New York City, that demonstrated when he exposed children to the roof of a New York City hospital, they demonstrated they could cure rickets. In 1931, our government actually set up an agency telling parents to put your kids outside to get some sensible sun exposure. In fact, in this day and age, unchallenged for 40 years, have been the dermatologist telling you never to be exposed to direct sunlight. Because if you ever did, at least in the United States, you could wind up on America's Most Wanted for child abuse if you didn't put your child outside without a sunscreen. And so back in the 1930s, Harry Steenbach at the University of Wisconsin realized if you can irradiate people and animals to prevent rickets, why not irradiate food that led to the vitamin D fortification of milk, the eradication of rickets. We don't see rickets commonly, so we're not thinking about vitamin D deficiency. But this is the problem. Why is vitamin D deficiency such a common disease worldwide? Because humans have not appreciated that it's been sunlight that's provided us with our vitamin D requirement. Why? Essentially, no food contains enough vitamin D to satisfy that requirement. Vitamin D is rare, naturally occurring foods, and some fortified foods have so little that you would have to eat a lot of it in order to be able to become vitamin D sufficient. In fact, we did a study many years ago and showed from the N. Haynes data set that whether you're a child or a teenager, young, middle-aged, or older adult, even if you accepted the Institute of Medicine's recommendation of 600 units of vitamin D a day, essentially no one in the United States, even with dairy foods and orange juice fortified with vitamin D, can you get enough from your diet. And so as a result, you would have to drink 6 glasses of vitamin D fortified milk, 600 units a day, in order to get enough vitamin D. Turns out that mushrooms, when exposed to sunlight or exposed to ultraviolet light, have a huge capacity to make vitamin D. And the mushroom industry now is exposing portobello and white button mushrooms to ultraviolet light, and so you have about 400 units in a serving. Also, salmon, especially wild-caught salmon, have about 500 to 1,000 units in a serving. But as you can see, if you need at least 600 to 1,000 units of vitamin D a day, which is what is recommended by the Institute of Medicine and the Endocrine Society, that you cannot easily get it from dietary sources. So when can you make vitamin D? And where in your skin do you make vitamin D? Well, it turns out that in the summertime, everybody knows when you're exposed to sunlight, you can make vitamin D in your skin. But what about in wintertime? And we did a study. Here in Boston, we also did a study in Edmonton, Canada, and in fact, we've done studies around the globe to ask the question, at what time of the year can you make vitamin D? And it turns out that if you live above Atlanta, Georgia, basically about 33 degrees north or 30 degrees south latitude on this planet, you basically cannot make any vitamin D during the winter months. So up here in Boston, for example, November through February, you cannot make any vitamin D. Now, what about time of day? Well, it turns out that time of day is equally important. Even in the summertime, in June, at 8 o'clock in the morning with the sun shining brightly, or 6 o'clock in the afternoon, you will not make any vitamin D in your skin. Most vitamin D production occurs between about 10 a.m. and 3 p.m., and before and after that, essentially no vitamin D is produced in your skin. And so what are the issues about sunlight and the negative effects? There's no question. Excessive exposure to sunlight increases risk of non-melanoma skin cancer. Easy to detect and easy to treat. And for older adults, they worry about wrinkling. And so there's an evolution in thinking about beachwear. In the 1950s was 2-piece, in the 70s was 1-piece, and now with the new millennium, right, lots of clothing and a lot of sunscreen. So if you put a sunscreen on with a sun protection factor of 30, it will absorb about 95 to 98% of the UVB radiation that hits your skin. As a result, you reduce your ability to make vitamin D in your skin by about 95 to 98%. Now, one of the issues and one of the questions that will be coming up will be, can you wash vitamin D off your skin immediately after being exposed to sunlight? And the answer is no. And the reason is that the vitamin D is produced in the living cells in your skin, mainly in your epidermis, so you cannot remove it from your skin. When you're exposed to ultraviolet radiation, not only do you make vitamin D in your skin, but you also make beta-endorphin. We had showed many years ago that when you are exposed to UVB radiation, keratinocytes, the epidermal skin cells, produce beta-endorphin. And this may be one of the reasons why people feel better when they're exposed to sunlight. And new evidence has suggested that NO, that nitric oxide, nitrous oxide is also being produced in the skin. And as you're well aware, NO is a major regulator of controlling blood pressure. And so some of the observations that were made back in the late 1970s demonstrating that the higher the latitude that you live, higher is your risk for having hypertension. And we demonstrated that when you're exposed to tanning bed radiation, that your blood pressure dropped. It could in part be due to the production of NO. 90 to 95% of your vitamin D is still coming from casual exposure to sunlight. So then the next question is, how much do you want to be exposed to? Well, I never encourage burning. And certainly living in Boston, we don't want to look like a red cooked lobster. But what I do recommend is sensible sun exposure. And what does that mean? Well, if you're outside in a bathing suit on the beach and you get a light pinkness to your skin 24 hours later, is what we call a minimal erythemal dose. That's comparing it to, say, an oral dose of vitamin D. It's equivalent to about 15,000 to 20,000 units of vitamin D. So you could see that your skin has a huge capacity to make vitamin D. So what about aging? Well, we know that aging has a lot of effects on metabolic processes, and we went on to show that indeed, if you're 70 years old and exposed to sunlight, you make about 25% of the vitamin D that you would make if you were 20 years old. So the obvious question is, can elders make any at all? And we showed, and others have shown the same, that if you take elders and expose them to a reasonable amount of sunlight, if they know they're going to get a mild sunburn, say after 30 minutes, I would have them exposed for about 10 to 15 minutes of arms, legs, abdomen, and back, 2 to 3 times a week in the spring, summer, and fall, followed by good sun protection. And that's a good recommendation for children as well as young, middle-aged, and older adults. No matter what your ethnicity, you can produce vitamin D in your skin, and almost no matter what latitude as well. And a study done in Denmark showed very nicely that the blood levels of 25-hydroxyvitamin D increased substantially. And so we went on to show that if you are of dark skin, a typical African American, most of the ultraviolet radiation is absorbed by the skin, and as a result, they reduce their ability to make vitamin D in their skin by 5 to 10-fold compared to a Caucasian. So as a result, often African Americans are at much higher risk for vitamin D deficiency and require to be outside for sometimes 3, 5, up to 10 times longer to make enough vitamin D. And so we know now that vitamin D deficiency not only will cause rickets in children, but this painful bone disease, often misdiagnosed as fibromyalgia, called osteomalacia. It improves muscle function as well. And so as a result, improving your vitamin D status, both from increasing your dietary intake, vitamin D supplementation, and sensible sun exposure in the spring, summer, and fall, can really guarantee good health, improve muscle function, and give you a feeling of well-being. There are a couple of studies that are worth mentioning. The first is, as you well now know, that most cells in the body have a vitamin D receptor, and why would they be there? As early as 1915, it was shown that if you're an indoor worker in San Diego, you had an 8 times higher risk of dying of cancer than if you lived outdoors. In the 1940s, Apperly showed that those living in the Northeast were more likely to die of cancer than if you lived down south, even if you were at a higher risk for getting skin cancer. The Garland brothers began to show this interesting latitudinal association with increased risk for ovarian cancer as well as colorectal cancer. And many studies have now shown that increasing your 25-hydroxyvitamin D levels may reduce risk of many deadly cancers. One study done in Canada showed that women exposed to the most sunlight during their teenage and young adult years reduced their risk of getting breast cancer later in life by almost 70%. So what about the negatives? Certainly you worry about skin cancer, and as I said, often most skin cancers are non-melanoma, easy to detect and easy to treat. The most common deadly skin cancer, however, is melanoma. It's curious that most melanomas occur on the least sun-exposed areas, and occupational sun exposure decreases risk. So I think that the recommendation for me is clear, which is that we should have a 3-part strategy to improve our vitamin D status. and overall health and well-being. That is, to eat foods that are rich in vitamin D when you can, or when they're supplemented with vitamin D, to get a little bit of vitamin D. To definitely take advantage of the beneficial effect of sunlight, that is sensible sun exposure, and to take a vitamin D supplement. The Endocrine Society recently recommended to prevent and treat vitamin D deficiency, children should be on 600 to 1,000 units of vitamin D a day, and adults 1,500 to 2,000 units of vitamin D a day. And for those that are obese, you may need 2 to 3 times more vitamin D to satisfy that requirement. Finally, I'll leave you with one last thought. A study was done in Australia, the skin capital of the world, and they looked at vitamin D status in Australian dermatologists. And guess what? 87% of dermatologists in Australia were found to be vitamin D deficient. And so now the Australians are appreciating the beneficial effects of the sun and beginning to recognize and to recommend sensible sun exposure for your health. So thank you very much for your kind attention, and I'll be happy to answer the questions that were provided to me by Carol. Thank you.
All right, we have an entire list of questions here, my dear audience, and Dr. Holick will answer as many as he can. So I would like just to start with question number 1, which you can now see on your screen. I will highlight it for you so it's a little easier to look at here. Question number 1, you've already addressed somewhat, but how long does it take vitamin D to be absorbed, and does washing with soap during this time remove the vitamin D?
Yeah, it's a good question. I mean, it turns out that there's this misconception about vitamin D being absorbed. You make vitamin D in the living cells in your skin, and once it's made, it's released out of the cell and directly into your bloodstream. And so from my perspective, I don't believe you could ever wash it off your skin, that's really not an issue.
Question number 2, is it better to obtain vitamin D from sunlight or to avoid UV exposure and take supplements? Does sunlight have benefits that go beyond simply creating more vitamin D?
It's a very good question, and I recommend that everybody take a supplement because you can't always guarantee you're going to get enough vitamin D from sun exposure because we're always working all the time. And like I said, you only make vitamin D from 10 a.m. to about 3 p.m. and only in the spring, summer, and fall unless you live near the equator. Also, we know if you make vitamin D in your skin, it lasts 2 to 3 times longer in your body. And we also know when you're exposed to sunlight, you feel better, probably because you're making beta endorphin. And there is some evidence that it may reduce blood pressure, and that may be because of NO production.
Fantastic. In number 3, in your book, The Vitamin D Solution, you state that sunlight makes not only vitamin D, but at least 5 and up to 10 additional photoproducts. What are these, and what are their benefits to the body?
It's a good question, and we're still on the hunt for many of them. We've identified them in skin, and we're beginning to find that they have some unique biologic properties, and it could be one of them is to actually regulate cell growth and reduce risk of skin cancer.
Number 4, what is the bioavailability of oral cholecalciferol from supplements in percentage? Is it 100% bioavailable? Are vitamin D granules more bioavailable than tablet formulations?
Yeah, it's a good question. I don't think that we know what the percent bioavailability is, but we've done studies with vitamin D3 in orange juice, in corn oil, placed on a piece of bread, in form and in powder form in a capsule. And for the most part, when we measure blood levels of vitamin D 12 to 24 hours later, they are the same. So we believe that for the most part, vitamin D in almost any formulation is equally bioavailable.
The next page of questions, number 5, do you think tanning beds are safe and a better way of getting vitamin D than supplements?
As you probably are aware, if you read my book, I don't advocate tanning, but those that wish to do should do it responsibly. And we did a study in tanners in Boston, and we showed that tanners exposed to tanning bed just once a week had robust, healthy levels of 25-hydroxyvitamin D and actually had higher bone density in their hip compared to non-tanners, where their blood level on average was about 18 nanograms per ml in the wintertime. So for those that wish to get some vitamin D from a tanning bed, I typically recommend sun protection on your face because it's the most sun exposed, most sun damaged, and only go in for about 25 to 50% of the time recommended for tanning. Your skin will instantly make vitamin D and can supplement your vitamin D status.
Question number 6, is the average over-the-counter vitamin D supplement made with healthy ingredients?
It depends on who is manufacturing it. For the most part, the major manufacturers, from my perspective, that the ingredients appear to be appropriate, and I'm not sure what it means to be healthy, but certainly they're not harmful.
All right. Number 7 seems to be kind of a carry-on of that, about the source of vitamin D. Is the vitamin D from fat, wool, danger of prions, or from irradiated mushrooms better?
It's a very good question. It turns out that you don't just simply get the vitamin D from fat wool. If you did, maybe you'd worry about this, but what they actually do is they collect cholesterol. It then goes through a chemical process. It then gets irradiated. And so there's just no way that prions could be in any way related to the vitamin D that is produced from wool from fat. Irradiated mushrooms do make vitamin D, and it can be an excellent source of vitamin D.
Question number 8, are there other nutrients that enable us to utilize the sun's energy for our health?
It's a very good question. What we know is that sunlight can certainly have an effect on folic acid, and there is some suggestion that possibly that's one of the reasons for skin pigmentation to have evolved. But I'm not aware of any nutrients per se that are enhanced by the sun's energy.
Question number 9, are there any patient types for which we should be concerned about absorption of vitamin D3?
Yes, certainly patients with any kind of fat malabsorption syndrome, inflammatory bowel disease like Crohn's disease, or ulcerative colitis. But also we find many patients that we treat with vitamin D often don't raise their blood levels of 25-hydroxyvitamin D because they suffer from silent celiac disease. And so often we will evaluate patients for celiac disease, and on occasion we will find that the patient has celiac disease and can now better absorb the vitamin D. If you're taking cholestyramine to control your blood cholesterol level, or any kind of drug that will absorb fat in your gut to prevent you reduce risk for obesity, will also absorb vitamin D, and so often these patients should be taking the vitamin D separate from the cholestyramine or these drugs that can inhibit fat absorption.
Question number 10, is vitamin D synthesis reduced over age 60? And if so, how much additional exposure to the sun is required to produce the same amount of vitamin D as a younger person?
Yeah, as I had mentioned in my talk, is that a 20-year-old makes about 2 to 3 times more vitamin D in his or her skin compared to a 60 or 70-year-old. But that doesn't mean you should be outside longer, because the body only will permit you to make so much vitamin D, and then you begin to break it down. So instead, what you want to do is not have longer exposure time, which will damage your skin, but rather expose larger surface area. So now more of your legs or more of your arms or abdomen and back, if you wish, to be able to make the amount of vitamin D that you desire. We did a study in 70-year-old men and women, and we demonstrated that putting in our tanning bed under ideal circumstances for, again, the amount of sunlight that would be about 50% of what would cause a light pinkness to your skin 24 hours later. We were able to raise their blood levels into the 35 to 60 nanogram per ml range without difficulty. And there's also a product on the market called a Sperti lamp, S-P-E-R-T-I lamp, that often can be valuable, especially for patients with fat malabsorption syndromes.
Question number 11. A gentleman, a man of 88, living in the United Kingdom where we had almost no sunshine last summer. He takes 12,000 IU a day and currently has a serum level of 59 nanograms per milliliter. As long as I remain with this amount of D in my blood, does it matter that I am not assimilating anything from the sun?
It's a good question. I mean, as far as we can tell right now, there doesn't seem to be any difference from taking a vitamin D supplement regarding your vitamin D status versus being exposed to sunlight. But as the other questioner asked, what about those other photoproducts? What about beta endorphin? What about the production of NO? All of that you miss by not getting some sensible sun exposure. So I do recommend sensible sun exposure along with vitamin D supplementation, and like I said, eating foods that either naturally contain or are supplemented with vitamin D.
Dr. Holick, we're going to do this last question and then we're going to close. The question that we have, number 12, do you think it's best to get your sun at high noon when the UVB rays are stronger?
As it turns out, the answer is yes. That usually between about 11 and 1 o'clock in the afternoon is the best time because you're about 80 to 100% efficient in absorbing those UVB rays and producing vitamin D. If you're exposed to sunlight at 8 o'clock in the morning, the sun is shining brightly, you're not making any vitamin D in your skin, but you're getting blasted actually by UVA radiation, which can increase risk for melanoma as well as for skin wrinkling.
Dr. Holick, some more questions for you. A U.S. Army study and a Korean study showed vitamin D levels decreased with only forearms and faces exposed. Sometimes it is said that that's enough. How do you measure local UVB?
So it's a good question. It turns out that it's what's called a rule of nines, which means that 9% of your body surface is your face, 9% for each of your arms, 18% for each of your legs, and 18% for your abdomen and thorax, and 18% for your upper and lower back. And so that basically equals 100%. And we know that if 100% basically is exposed, that is in a bathing suit, that you're making about 15 to 20,000 units of vitamin D. So if you're only exposing less than 10%, that means that you're making less than 1,000 units of vitamin D a day. And I know from our studies and from other studies that adults need a minimum of 1,500 to 2,000 units a day to satisfy that requirement.
All right. How do I get the right amount of sun through the seasons? I've heard that the angle of the sun is important as well as the length of exposure. Could you give me some specific guidelines to use for myself and my clients?
Unfortunately, I can't give those recommendations because it depends upon time of day, season of the year, latitude, altitude, and your degree of skin sensitivity, i.e. your degree of skin pigmentation. In my book, The Vitamin D Solution, at the end, I actually have tables telling you anywhere on the globe, any time of the year, for any skin type, how long to be outside. But I could give you some idea. That is, for me, being very white, I know that if I'm in Boston in the summertime, and I know I'm going to get a mild sunburn after being outside for 30 minutes, that I'll expose my arms, legs, abdomen, and back, say when I'm playing tennis, for about 10 to 15 minutes between the hours of 10 a.m. and 3 p.m., followed by good sun protection. Always protect your face. Most sun exposed, most sun damaged, less than 9% of your body surface area, so it doesn't make very much vitamin D anyway.
How much sun exposure is too much?
Well, bottom line is you never want to get a sunburn. Sunburning experiences is responsible for both non-melanoma skin cancer, but more importantly, melanoma as well. And that's why I always tell people you need to judge what your skin type is and your sensitivity to the sun. And if you know you're going to get a sunburn, a mild sunburn, after being outside for X period of time, then you should be out there for about 25 to 50% of that time, arms, legs, abdomen, and back, but always wear some protection on your face. So bottom line, never ever get a sunburn.
Always the common sense recommendations, aren't there? A gentleman asked, 2 summers ago, I reduced my dosage of vitamin D and topped up with sunshine to a reasonable amount of exposed skin between 11 a.m. and 2 p.m. My 25-OHD levels in the fall were much reduced. Would a vitamin D lamp likely be effective? I am 71 years old.
Well, there is, as I had mentioned in my presentation, what's called a Sperti lamp, S-P-E-R-T-I lamp. It's the only lamp that's sanctioned by the FDA for producing vitamin D in your skin. So for patients with fat malabsorption, for example, or they've had bypass surgery, gastric bypass surgery, we found that those lamps can be effective. But my recommendation usually is for my patients is to increase your vitamin D supplementation. And 2,000 up to 3,000 units of vitamin D a day is perfectly safe. If you're obese, you may need 2 to 3 times more.
All right. We have another set of questions here. Also, can higher amounts of UVA exposure, such as with sunlight through the windows or certain tanning beds, actually decrease vitamin D in the body?
Yeah, we've actually looked at this, and we don't believe so. But UVA will definitely damage your skin, increase risk for melanoma, alter your immune system, and also cause wrinkling. So we recommend that you limit your UVA exposure, which also occurs in the early morning and late afternoon.
All right. Another. Living in South London, can you advise how much time and the best time of day to get the most from sunlight? My children, all now young adults, are of mixed Indian origin. Do they require more sun than me because of their mixed ethnicity?
As I mentioned in my talk, certainly skin pigmentation is a natural sunscreen, and as a result, you need to take that into account. So, for example, my African American patients who want to get enough sun exposure, they often need to be outside 3 to 5 times longer. We did a study in Asian Pakistanis, and they have deeper skin color, and they needed 2 to 4 times more exposure to our tanning bed to make the same amount of vitamin D as a white person does. And in terms of the best time of day, it's between 10 a.m. and 3 p.m. And if you're living in London, you likely aren't making any vitamin D from about mid-October until almost May 1st.
All right. A family member has been diagnosed with Parkinson's disease. Could sun and/or D3 supplements be helpful about the symptoms or delaying progress of the disease?
There is some evidence that patients with Parkinson's disease are vitamin D deficient, but we know that most people are vitamin D deficient, and patients with Parkinson's disease often are indoors and are not taking advantage of the beneficial effect of the sun. And there is evidence that vitamin D deficiency causes muscle weakness. And so my recommendation for my Parkinson's patients is to definitely improve their vitamin D status. Raise their blood level of 25-hydroxyvitamin D in that 40 to 60 nanogram per ml range, which is recommended by the Endocrine Society. And by doing so, you may improve muscle function, muscle tone, and decrease some of the symptoms associated with Parkinson's disease. There is no evidence to date, however, that vitamin D treatment is a treatment for Parkinson's disease.
Dr. Holick, I have 3 more questions for you right now. number one, how does the sun affect fertility? And what is the best way to supplement and or increase absorption rates? Two actual rolled into one there.
Right. Well, first of all, like I said, you're not absorbing vitamin D, you're producing vitamin D in your skin, and the best time is from 10 a.m. to 3 p.m. in the spring, summer, and fall, and never to be sunburned, so to get about 50% of the time that would cause a mild sunburn to your skin. In terms of fertility, it's well known and documented that in ducks, for example, that their fertility is definitely related to season of the year because of circadian rhythms. It's less clear how important circadian rhythm is for fertility for humans, but often it's been suggested that the highest fertility is during the spring, summer, and early fall.
All right. The second one is, can vitamin D be absorbed and manufactured if the liver is damaged or if the gut is not well?
If the gut is not well, so you have Crohn's disease, ulcerative colitis, celiac disease, or any number of disorders that would cause fat malabsorption, you will not be able to efficiently absorb vitamin D. As a result, you can increase the amount of vitamin D that you're taking orally. If you can't absorb any vitamin D whatsoever, I have some patients with Crohn's disease that have only 2 feet of their small intestine left, for example, then I will recommend them either to go to a tanning salon where the tanning bed have fluorescent lights so that they can produce vitamin D, and again, sun protection on your face, and 25 to 50% of the time recommended for tanning. So you don't really want to tan per se. Or to get a Sperti lamp, S-P-E-R-T-I lamp, and you can find that on Sperti.com, which will produce vitamin D. It's a small lamp system, and I usually have recommended to my patients that they can expose their abdomen and back and lower legs 2 to 3 times a week to the amount of time recommended by the manufacturer.
And 1.5 more. I have one special one too. A person asks, I have chronic fatigue and pain from fibromyalgia. Can vitamin D improve these conditions? What does my serum level need to be?
In my experience, many patients that I see in my clinic that come to me with a diagnosis of fibromyalgia, these classic signs where the doctor will press on your bones and they consider it to be a trigger point, that's also a classic physical sign for osteomalacia. Many of these patients that I see are vitamin D deficient, and I explain to them that I will treat them for this vitamin D deficiency. I usually give them 50,000 units of vitamin D once a week for 8 weeks, and then I put them on 50,000 units once every 2 weeks thereafter. I tell the patients it takes a long time to get osteomalacia, and it takes an equally long time for it to resolve. So sometimes patients will only begin to experience relief of symptoms 2 to 3 months after starting vitamin D therapy. But many of these patients can definitely improve their muscle function and their symptoms of fibromyalgia. It's not for 1 minute am I suggesting that vitamin D deficiency causes fibromyalgia, but rather vitamin D deficiency and those symptoms associated with it are very similar to those that people experience with the diagnosis of fibromyalgia.
Thank you. And I have one more, Dr. Holick. With the new things, actually it's just more new publications, I think, showing how important the sun is, for example, in the generation of nitric oxide in the skin to protect our hearts and all the various cellular processes that are going on. Do you see that there will, in a relatively short period of time, be a greater appreciation of the sun and its power again, as opposed to the total fear of stay out of the sun, it's going to hurt you?
Yeah, I mean, if you go back into history, it turns out that Finson received a Nobel Prize in 1903 because he realized that people that had tuberculosis infection of their skin
got better when they were exposed to sunlight. We're now beginning to realize that the skin is basically a factory that can make a wide variety of important biochemicals that likely have important health benefits. And at least 3 of them that I've mentioned are vitamin D, beta-endorphin, and nitric oxide.
Fantastic. We very much appreciate, again,
So,
your...
Carol?
Excuse me. Yes,
One last
go
thing.
ahead.
You didn't ask me question 19.
I'm sorry. Well, please, let's ask...
You didn't. Question 19.
Please answer. The question is, do you
Yep.
think megadosing once a week is better than taking vitamin D every day?
And it turns out that you can take 50,000 units even once every 2 weeks and raise your blood levels of 25-hydroxyvitamin D in what we consider to be the healthy range of about 40 to 60 nanograms per ml. And it's essentially the same thing as taking 2,000 to 3,000 units a day. So taking it once a week, say 25,000 units, or 50,000 units every 2 weeks, or taking 3,000 units a day is equally effective in raising and maintaining your blood levels of 25-hydroxyvitamin D.
The important thing is to do whatever works for that particular person then, isn't it?
Well, correct. I mean, sometimes for some people it's just easier to remember to take it every day. That's what I do.
Sure.
But others prefer to only have to take it twice a month and to be as a prescription, which is available in the United States as 50,000 units of vitamin D2, because A, the pharmacy will call you to remind you to pick it up, and because it's a prescription, often patients will take it more seriously than if I simply tell them take a supplement every day.
Fantastic. And again, I thank you for your sharing your great knowledge with us, and I look forward to more such seminars over the ensuing year. Dr. Holick, thank you again very, very much.
My pleasure. Have a delightful day.
You too. Bye-bye.
Bye-bye.
Thank you for listening in to another of the Grassroots Health webinars. Please join us again next Tuesday as our very own Carol Baggerly, Director of Grassroots Health, presents on moving research into practice now. What does it take? Log in to this session next week and hear what's been working to get the vitamin D message out, what needs to happen next, and how you can and do play a major role. Carol will discuss the Vitamin D Action Project and how it's expanding into community modules for pregnancy health, cancer prevention, and other community interests. We are actively seeking sponsors for these webinars. If you are interested in sponsoring a session or contributing in any way, we encourage you to log on to joindaction.org today or email us at webinar@grassrootshealth.org. Thank you again for joining us. Have a wonderful day.